Sorry about that. That's one thing with this phone. When you have a million things on its phone, it does tend to lose battery very, very quickly. And plus, since I did not charge it and I slept on it, it holds battery very, very well, though. Don't get me wrong. It's a Note 3. I'm not really sure where I left off at. I think I was I was just explaining pretty much like what's been going on and stuff. Mother's Day was just crazy. Mother's Day, I was 25 I think I was 26 weeks Mother's Day, and I was having bad contractions where I could not even go to the bathroom. It was horrible. So I just decided that I need to go in because I just thought, okay, these are the signs of preterm labor. I was not trying to go in, but I knew I needed to go in. I did everything from switching positions to drinking a lot of water. And when I went in, they pretty much told me that I was slightly dilated and just be careful to just rest more. Bed rest, definitely. Don't be so hard on myself. Try not to bend down as much. Just, different things like that. So, that definitely came as a shocker. Around this time, I was taking classes, which was very fun. I did the breastfeeding class. It was like 3 hours long. It was really, really, really informative. It told you about different ways to breastfeed, why breastfeed, just different ways to breastfeed, why is it beneficial. Of course, it's a bonding time, but also because it's cheaper. Helps with baby immune system, helps with your immune system, helps lose weight. Just a couple things, ladies, that we need to, be aware of. Really good things that we need to be aware of also. Helps with jaundice. It helps with sleeping better. Just a little couple things that it does help with. I also took a childbirthing class, and it was childbirth series class. So it talked about C-sections, VBACs, it talked about vaginal births, it talked about, how do you swaddle a baby, which was awesome. We did learn that. You got a certificate, so it was pretty cool. Just a couple things. It talked about, with the right breast pump, and then breastfeeding classes they did also. The right breast pump for you, how to express your milk, how to, recover the correct way after giving birth, whether it's C-section, VBAC, or vaginal. Natural births. It talked about medications. It talked about getting ready for birth. Have your hospital bag ready. Have your birthing plan written down. We did a nice tour, another tour pretty much, and the tour was really, really cool and really comforting, I'll say. So that's the things that we pretty much worked with. And at that time, I'm just getting I'm actually a nice size now. A lot of people don't seem to think that I'm so far along. They're like, oh my gosh, you're really ready to just give birth. I'm like, yeah. And also, since I'm high risk, I have a chance of giving birth at any time, but we're trying to avoid that. That was really, really cool. And also a major, major thing, and I did want to put this in my video. Parents are worried about spoiling their baby, and what was told was newborn, infancy, babies, period, you can't spoil them right now. The way they communicate is through crying. They will learn later on not to cry, maybe around 1.5, when they can talk a little bit or they can show you things. But when they're little, picking them up, stuff like that, that's not how they really get spoiled. But a lot of people believe that that is how they get spoiled, and they're going to still believe that even after I say this. But yeah, some people will do the co-sleeping. Some people will do for Verizon. Some people will just keep, a bassinet or a crib next to the bed or whatever. It's what's comfortable for you. You do not need to worry about the world and what's comfortable for you. And I like how the teacher, she talked about just getting to know baby, mother getting to know baby, daddy getting to know baby. People that's around, help them if you want to see baby, do certain things. Like, okay, you want to see the baby, I keep running back and down, up and down the steps, but you say you're coming to the house or something like that. Can you pick up dry cleaning before you come here? That's a good way to see. I'm not gonna say you have to earn to see the baby, but it just helps. Have like certain people, at least like 5 or more people helping out with certain things. Ask them, hey, I just gave birth, can you help me with this and that or something like that. They talked about the main thing, and this was really, really important also. Healing process will take up to 4 to 8 weeks. Some people say 6 weeks. That's not always the case. Some people say 10 weeks. It just depends. Mostly when it comes to your, getting your period back and stuff like that, the more you're moving around, the more you're going to shed and blood is going to come down. So try not to move around so much. Make sure your plan, you have, like, if you have stairs, probably stay downstairs, set up downstairs for a little bit. Or if you're going to stay upstairs, set up upstairs and make sure you stay upstairs most of the time, especially if you're going through a C-section. They talked about body wraps and stuff like that too. What to get the baby and what the baby doesn't really need, but some people still get, stuff like that. So all that stuff was really, really interesting, and I really did learn so much. And I've been dealing with kids for like 10 to 15 years of my life, and I still learn things, and I choose to learn things new every day about a baby or about a child or about anything in general. So yeah, that was those things were really, really cool, and I really did like the classes. So I recommend the classes. I recommend you go to breastfeeding and childbirth series classes because it helps you out, especially if you don't know what you're getting into. And a lot of babies are around me. A lot of mothers tell me certain things. A lot of daddies tell me certain things, but when you see it yourself, it was just like, okay, awesome. I like this. And they explained it very well. So pretty much 30 weeks. 30 weeks was not that bad at all. I did 31 weeks. I had to go back to the hospital. I believe that's when it was Father's Day. What is it about Mother's and Father's Day? Father's Day, or close to Father's Day. I had to go in because I called my nurse, I was like, hey, I live far from a hospital. Don't want to go in really unless I really have to or unless y'all say something. I told her I'm feeling pressure, very, very hard pressure, like, something's coming down. I don't know what's going on. I was having vaginal pain, and she said, how many weeks are you? And I said, I think I said 32 weeks. And she was like, come in. That's it. Just come in. And I was like, okay. And I'm like, well, is everything okay? And she's like, don't worry about it. Just come in. That could be signs of preterm labor. You need to come in so we can check you and stuff. So when I went in, they did check me. They checked my cervix. Turns out, little baby girl. She also switched at 30 weeks also. I think at 28 weeks. 28, 29 weeks she switched, and now she's breached, and she's still on her tummy, breached, and she has like one foot like this, on her head. Everybody thought that was a hand, but it's actually her foot, and then another one like, down some type of way. I don't know how to explain it. I have another ultrasound and sonogram, so I'll tell you about that also. But pretty much, they told me that some type of way her back was on my cervix. So it made it very, very uncomfortable, and they couldn't do anything, And they was just like, I'm sorry, but, just have to wait it out. I'm like, oh my gosh, are you kidding me? So, yeah, that was another time I went into the hospital. And then I got sick. I got a upper respiratory infection, and I went through 4 asthma attacks in that week, and it was no joke. I was trying not to, take my inhaler, but I did have to take my inhaler, and I wound up taking amoxicillin, because, everything, infection, I had to take it for 10 days. And then after that, pretty much, I got sick again, like a week later. Just my immune system felt open, and I got another infection I was just getting over, and this one was horrible, like nosebleeds, ear aches, couldn't breathe, throat was sore. I thought it was a strep throat, body aches, then I thought it was like flu, but I got my flu shot, I got my whooping cough shot, things like that. So I didn't know what was going on. They just gave me a penicillin shot, and that was pretty much it. So it was like some days I was okay, some days I wasn't, because you can't take steroids with penicillin, and that's what kind of helps, to keep the penicillin shot, cannot talk, strong. So since I couldn't take it, I just had to deal with it pretty much, and it was no joke. It was horrible. So yeah, that was just horrible. And I wound up going back to the hospital too, because when I called a nurse, she was just like, you're having leakage, and I told her what was going on and stuff, and she was like, well, let's come in, we're just gonna check you. And then it turned out everything was okay. It was just more mucus stuff coming out, just everything getting ready for baby or whatever. And it was just we're not going to admit you. We're not going to keep you. You're okay. You're not in labor or anything like that. I was like, cool. I'm just worried about bacteria infection. And they, told me what to do. Call my GYN, my OB-GYN. He's both. Yeah, I say GYN because he was my GYN first. But call my OB, tell him the situation. He's going to, get some tests done. Okay. And then everything was pretty much okay enough for me to go home. I'm going to do another video, so stay tuned for part 3.